Tonight, America's mental health is unraveling. We'll talk about why so many people feel stuck, hopeless, and unseen. We'll break down the policies that gutted the system, the stigma that still chains people in silence, and how the world's richest country can somehow afford 12 aircraft carriers, but not a working suicide prevention line. And yes, this is one of those nights where we don't just talk symptoms, we talk systems. Because when people say get help, they don't mean apply for assistance, wait 6 months, and then cry out a parking lot. Buckle up.
Quick pit stop. Before we go full nerd, hit that like button, subscribe, and smash the bell icon just like it cut you off in traffic. Seriously, it helps the show, and it means you'll never miss an episode, whether I'm ranting about politics, potholes, or whatever else Indiana throws at us.
Welcome back to Hold 'em Accountable. I'm Derrick Holder, your friendly neighborhood Marine turned microphone wrangler, here to talk about something we've all brushed up against, whether admit it or not, America's mental health crisis. This is not just a soft issue. This is infrastructure for the human spirit. And if you think that sounds dramatic, good, because this story is dramatic. We'll look at where we are, how we got here, what's failing, and what's actually working. And maybe, just maybe, how we climb out of the hole. Spoiler alert, it's not by telling people to just go outside more. 1 in 5 adults in the US will experience a mental health illness this year. That's 20%, roughly 60 million people. To put that in perspective, that's about the same as everyone in California, Florida, and Indiana combined, if they all decided to see the same overworked therapist in Muncie. Suicide is now a leading cause of death for Americans under 40, and for teens and young adults, it's second only to accidents. And no, I don't think you can call this one an accident. We've also seen depression rates triple since 2015, anxiety and PTSD off the charts. A 2024 NIH report said nearly half of all young adults report feeling persistently hopeless. That's half a generation looking at the future like it's a YouTube buffering screen. And let's not pretend that this is just a coastal issue. In Indiana, where our state bird is technically a cornstalk in a tornado, suicide rates are above the national average. Over 1,000 Hoosiers died by suicide last year, according to the Indiana Behavioral Health Commission. That's more than traffic accidents, more than homicides. That's what a mental health crisis looks like: quiet, invisible, but everywhere. So, okay, let's say you're struggling. You decide, hey, I'm going to get help. Good luck. Step 1, find a therapist who's taking new clients. You can't. Step 2, find one who takes your insurance. You still can't. Step 3, find one who costs less than your rent. Ha! No. Nearly half of U.S. counties, especially rural ones, don't have a single practicing psychiatrist. Indiana, we've got entire counties, Morgan, Benton, Owen, that can go months without a single behavioral health provider available. And if you do find one, be prepared for the great American pastime, insurance limbo. Insurers will happily cover a $40,000 ER visit, but tell them you need 6 therapy sessions? Suddenly, they've got questions like, have you tried not being tired and not sad? Then there's stigma, especially for veterans, men, and working class folks. I've heard it all. Real men don't need therapy. Yeah, real men also don't die from untreated PTSD, but they do all the time. Here's the truth. Getting help shouldn't feel like running a bureaucratic obstacle course while on fire. But in America, that's the system. To fix this mess, we need to talk history, because this didn't happen overnight. Back in the mid 20th century, mental health in America meant one thing: institutions, huge state run asylums. Some good, many horrific: abuse, neglect, overcrowding, It was a national disgrace. So in the 60s, under Kennedy, we said, let's close the institutions and move care into communities. Great plan. Community Mental Health Act of 1963. But here's the problem. We closed the hospitals before we built the clinics. The result? Millions of people released with no safety net, no follow up, no resources. It was the equivalent of saying, we're abolishing prisons, but everyone gets one free coupon for good behavior. By the 80s, states were slashing mental health budgets, and the federal government was shrugging. Reagan cut mental health spending by 25% in his first term. Since then, every recession has made things worse. That's why today, prisons are the biggest mental health providers in the country, not clinics, not hospitals, prisons. Indiana alone, nearly 40% of inmates are diagnosed with a mental illness. But sure, tell me again how we're the law and order state? In 2008, Congress passed the Mental Health Parity and Addiction Equity Act, promising that insurers would treat mental health care the same as physical care. And that was adorable because enforcement is a joke. Insurers still deny claims, create narrower networks, and nickel and dime therapy until people quit. A federal audit in 2022 found that over 90% of health plans were non-compliant with parity rules. That's not equality. That's gaslighting. Now layer in everything else: social media addiction, student debt, income inequality, political chaos, pandemic trauma, the feeling that the world's on fire and you're holding the hose wrong. And people wonder why anxiety is through the roof. Maybe young people just don't want to work. No, they just don't want to have panic attacks while doing it for $9.75 an hour without benefits. And that's not just young people. Middle-aged men have the highest suicide rates in the country. Why? Because they've been told their whole lives that asking for help makes them weak. I grew up around that mindset. As a Marine, I saw it firsthand. You get trained to suck it up. But when you leave service, no one tells you how to unsuck it. So you end up with veterans sleeping in cars, families falling apart, and the system says, well, we have pamphlets. This is where we are, a society that glorifies toughness, underfunds compassion, and wonders why everyone is falling apart. But don't worry, Congress is totally on it. They just formed a task force that'll release a 200-page report in 2028 titled, Oops. All right, let's talk about what's really broken here. Because this isn't just people falling through cracks. This is a system built out of cracks. The phrase mental health care system is misleading, like calling a pile of broken Legos a castle. Let's start with everyone's favorite villain, insurance. Health insurers love to say they cover therapy. Sure, 3 sessions scheduled for 8 a.m. on alternate Tuesdays in a basement behind the BMV. The 2008 Mental Health Parity Act was supposed to fix this, requiring equal coverage for mental and physical health. But according to a federal audit, over 90% of insurers are non-compliant. That's like giving everyone a parachute and then forgetting to attach the cords. So you get people with diagnosed conditions being told, we don't think that's medically necessary. Medically necessary? Sir, the man hasn't slept in 4 days, is chewing drywall, and thinks he's in a Truman Show reboot. What do you mean, not necessary? And here's the thing. When therapy isn't covered, people turn to medication as their only option. Not because it's the best treatment, but because it's the only affordable one. So we've basically turned psychiatrists into pharmacists and therapists into luxury services. Would you like trauma recovery or a new iPhone? For millions of low-income Americans, mental health care runs through Medicaid, but the system is overwhelmed. Indiana alone, one of 12 states, still catching up from pandemic era funding cuts, has a behavioral health provider shortage that's reached critical levels. Some counties have wait lists up to 9 months for basic therapy. That's not care, that's a dare. Medicaid reimbursement rates are so low that many clinicians can't afford to accept those patients. When states underpay, the domino effect hits everything: staffing, quality, outcomes. So people get bounced from ER to shelter to jail and back, just like a very sad version of musical chairs. Let's be blunt. In Indiana and across the country, the largest providers of mental health treatment are jails and prisons. 40% of inmates have diagnosable mental health disorders. Instead of care, they get 23 hours in a cell and a half an hour of medication review every 2 weeks. That's not justice. That's warehousing pain. The mental health system isn't one thing. It's a dozen agencies that don't talk to each other. You've got health departments, Medicaid offices, criminal justice, social services, and education, all running separate programs, separate budgets, separate definitions of help. Imagine a relay race where every runner hands off the baton to the wrong person. That's America's mental health system. A parent calls a school counselor. They refer to a clinic. Clinic says, call the insurer. The insurer says, try Medicaid. Medicaid says, call your congressman. And your congressman says, have you considered prayer? It's chaos diagnosed as care. And let's talk about the groups we forget: rural Americans and veterans. If you live in small Indiana County, say Morgan or Putnam, you might have one mental health provider for every 10,000 people. That's like one firefighter for the whole town, except the fire is depression. Veterans, the suicide rate is 17% higher than the national average. The VA is trying, but the backlog is brutal. Some regions' wait times for first mental health appointment still 30 to 60 days. That's not support, that's a countdown. I say this as someone who wore the uniform. If we can send people to war in 48 hours, we can get them a counselor in less than 2 months. Okay, deep breath. There's good news. There are real solutions out there, and they actually work. The problem isn't that we don't know what to do, it's that we won't fund it. In 2022, the federal government launched 988, the mental health version of 911. You call, you get a counselor, not a cop. Indiana's version has been surprisingly effective. Calls went up by 40% and response times improved dramatically. But it's a big but. Most states only fund the call centers, not the mobile crisis teams that actually respond in person. So, yeah, you can call 988, but if you're in crisis in rural Indiana, your response team might be a guy named Randy with a phone. And I love Randy. He's just not a system. Next up, integrated care. That's where your doctor, your therapist, your social worker actually exist in the same building, sometimes even in the same visit. Studies show it reduces ER visits, improves outcomes, and costs less long term. But we don't scale it because, say it with me, it's not profitable enough. God forbid we fix the system if we can't sell stock on it. Prevention works, period. When schools hire counselors, fund SEL or social emotional learning, build trauma informed classrooms, dropout rates fall and test scores rise. Yet in 2024, 14 states tried to ban SEL programs because they said they were woke. If teaching empathy is woke, then good morning, sunshine. Wake me all the way up. And on the adult side, companies that invest in mental health support see higher productivity and lower turnover. But too many bosses think therapy's not their problem. Cool. Neither is your resignation rate. But look how that turned out. Then there's the community model, peer led support, crisis stabilization centers, walk in clinics. Cities like Denver, Austin, and even here in Indianapolis, peer programs have cut hospitalizations by over 20%. People helping people. It's almost like compassion actually works. Somewhere a lobbyist just broke into hives. We know what works. It's crisis lines that connect to real responders, clinics with integrated care, prevention, not punishment. We just need the one ingredient every good system requires: political will. And that's the part money can't buy unless it's lobbying. So now we've seen what could work. Let's talk about why it doesn't, because no good idea in America survives contact with politics. Mental health care isn't expensive, it's underfunded. We spend less than 2% of the federal health budget on behavioral health. 2%. Two. That's about what the Pentagon spends on office coffee, and probably better coffee, too. Meanwhile, private equity firms are buying up treatment centers because nothing says holistic healing like a company whose other investments include vape pens and oil rigs. And when the money dries up, so does access. States with budget shortfalls, first cuts are always mental health, because apparently mental health is considered optional, like car mats or dental cover. Politicians love to talk about mental health. We need to do something, they say, right before voting against the funding to actually do it. They'll hold hearings, cry at vigils, and then move on to arguing about drag shows and gas stoves. It's bipartisan negligence, too. Democrats talk about mental health, but often forget to fight for it. Republicans call for faith based solutions, then cut social spending. At this point, the only constant thing in Washington is the hypocrisy per capita. And underneath all that stigma, the quiet killer, we still treat mental illness like it's shameful, like you failed a moral test. You break a leg, everyone signs your cast. You have depression, people say, have you tried being happier? It's 2025. We can clone sheep and land rockets, but we still can't tell grandma that anxiety isn't a character flaw. And that stigma, it's hardest in rural places, like here in Indiana, where privacy is tight and gossip travels faster than Wi Fi. For men, veterans, farmers, it's brutal. Suicide rates among male farmers are double the national average because you can't exactly call in sad to work when you own the cows. That's why we've got to talk about this loudly, publicly, without shame. All right, here's where we stop complaining and start doing. Because the good news is, it can change. It just takes persistence. And here is how we start. Insurance companies love loopholes, so close them. Congress can give the Department of Labor real teeth to find insurers that don't comply. Can't prove parity? You pay penalties, period. Think of it like therapy, but for corporations. Step one, accountability. Step two, empathy. Step three, probably denial. States need to treat behavioral health like infrastructure. Fund it the same way we fund roads. Indiana's new Behavioral Health Commission plan, $130 million in community clinics. It's a great model, but it's a down payment, not a cure. Imagine what we could do if every state made that commitment. Normalize therapy like we normalize dental cleanings. You don't wait for a breakdown to fix your brain. Schools, workplaces, churches, every one of them can make this conversation normal. And if your pastor, coach, or boss says, we don't need to talk about that, they're exactly who needs to talk about it. The 988 hotline saves lives, but it needs funding and staffing, especially in rural areas. Volunteer, donate, advocate. Yes, because when you call 988, you should get a voice, not a voicemail. And here's the one point people hate hearing: vote. Vote for candidates who treat mental health as health care, not as a soundbite. because the same people cutting mental health budgets are the ones tweeting thoughts and prayers after every single tragedy. I know this feels heavy because it is, but here's what gives me hope. People are talking, communities are listening, the silence is cracking. And every person who shares their story, every vet, teacher, parent, teenager, makes it a little easier for the next one. That's how the stigma dies. Hope isn't a luxury, it's infrastructure, and it starts with us. This has been Hold'em Accountable. Tonight, we looked at a crisis that's not invisible, it's ignored. The system isn't failing, it's being failed. But we can fix it by voting, speaking, funding, and caring like it matters. Because it does. Check on someone, share resources, say the quiet things out loud. I'm Derrick Holder, Marine, Hoosier, and guy who's not afraid to say therapy literally saved my life. Stay kind, stay loud, and I'll see you next week.